I just knocked on the door, closed the door to provide patient privacy, performed hand hygiene. While I'm doing that, I'm introducing myself. I'm RN Hayes. While I'm doing that as well, after I finish washing my hands and introducing myself, I'm going to do 2 patient ID. I'm going to ask, are you Mr. Teddy? This is Mr. Teddy. Also, if he had something on his wrist, I would ask him, or if I had my paperwork, I would say, were you born on this such and such date, which is his date of birth. So, date of birth, I got that. Next, I would do, if Ted came in with somebody with him, I would do my HIPAA procedure, meaning the goal is not to give any information the patient does not want out. So I would ask the patient, Teddy, are you comfortable with me giving out pertinent information about you? Teddy said he's fine. If Ted said no, I would have to ask the person that Ted's with to leave the room. And I would explain to him that a few issues, this is a HIPAA situation and I have no control, this is up to the person. That being said, the next thing I would do is inform the patient of what we're doing today. I would tell Ted that we're going to do a heart and neck examination. Now, while I'm doing that, I would take out my stethoscope, alcohol pad, wipe down my equipment, make sure it's dry, and we'll start the procedure. Now, while we're doing that, of course, we're going to take, I would have taken vitals such as blood pressure, temperature, heart, rate, respiration, and then after I've done all that, I would state whether it was regular or normal, but for Ted, everything was normal. So the next thing we would do is we do a neck corticoid pulse. Now, for Ted, there would be 3 places on both sides of the neck he would check. He would check at the angle of the jaw, mid-cervical, and at the base of the neck. Now, while I'm doing that, I would make sure I only do one side at a time because we don't want to cause any blood flow not getting to the brain. So I would have my stethoscope. Place it over that, base of the neck, here. Well, base of the neck is here, but under the jaw, here and here, 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 and here. I would make sure I would feel for contours, make sure everything's smooth. Breast upstroke pulses are normal in strength, moderate, and they're equally bilaterally, meaning one is not stronger than the other. They're both working at the same time. Now, bruit indicates turbulence from the vascular cause or case caused by sclerotic narrowing. A bruit is audible, so once again, I could hear it. I hear a whooshing sound. Same with the murmur, but that means they have some type of condition going on. The next thing I would do with Ted is we would do a jugular vein venous pulse. So Ted is laying down. I'll make sure there's no pillow under his head, and I make sure Ted would turn his head away from me. I would have a flashlight, have Ted's head at a 45-degree angle, not flexing the neck, and I would stand over there and I use a flashlight to see the pulse. I would direct it on strong light tangentially for pulsations. Now, that being said, we just finished that. While I'm doing all of this, I would be asking subjective data questions like, have you had any chest pains? Have you had dyspnea, orthopnea, cough? Cough may be an indication of edema. That's very important. Have you had fatigue? Cyanosis or pallor? Edema, nocturia, you're urinating at night. Past histories of hypertension, I would ask if you had elevated cholesterol, heart, murmur, rheumatic fever, anemia, or heart disease. Next question I'd ask would be family history. Do you have family history of hypertension, obesity, diabetes, and coronary heart disease? And One of the last questions I might ask, and none of these have to be in any particular order, but the last serious questions I would ask is lifestyle, such as your diet, is it high in cholesterol? Salt, are you smoking? Alcohol use, drug use, and what type of amount of exercise you've had. Next thing I would do is your precordium. I would inspect and palpate your interspace 4 and 5th medial to subclavicle. So I would go to the Louis right here, first and second, boom, probably just below his nipple right here. That would be the mutual area for sound. So this is where I would palpate or inspect. Also, I'm palpating, checking things. I'm using palmar aspect of my 4 fingers. I gently palpate the apex and the base, searching for any other pulsonic noises. So what I would do is I would first use my diaphragm, then use the bell. So I use the diaphragm first when I'm checking, and I would use the Z pattern. So the aortic area would be here. Right across from it would be the pulmonic area, Erb's point. Right below a tricuspid area. So it'd be boom, 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 then boom. It would be the mitral valve. Now that's where I would check the mitral valve. That's where I would check for S1, S2, lub-dub, lub-dub. And while I'm doing that, I would identify any atomic areas. While I was listening, I would note rate, rhythm, identify S1 and S2 as I noted earlier. I listen for systole and diastole, any extra heart sounds or noises. I would repeat the sequence with, once I said before, with my bell. Okay, this is my bell, but I also use my diaphragm. I listen to the apex right here, but also I'll be listening for my S1 and S2 in the mutual area. Now, once I finished all of that, I would do my documentation. I would ask, have you had, okay, I put my stethoscope down, clean it again, put it away, wash my hands, and I would do documentation, meaning the questions I asked before, that's what I would document it. When I asked them, you had any chest pains, document that. Dyspnea, orthopnea, cough, fatigue, edema, any history of hypertension, heart murmurs if I heard anything, rheumatic fever. You know, I ask you, when was your last ECG in the past 2 years? You know, I would say if the results were normal and they note all normal, no stress or ECG other than the heart test. Also, the question I asked you about family history, obesity, smoking, hypertension, diuretic medications. Also, this is a time, if this is a regular examination, we're doing this every year, I would do a medication, every so often you want to make a check of the medications they're taking and the medications you might want to take off the list where you reconcile and change. You might have to take some things off or add some things to compare it. What I would do is if the patient's not sure what they're taking, they know they're coming to see me, I'd say bring your medication with you. If you have a list, bring your list as well so we can compare what you're taking. Also at this time, I'd ask any personal habits. What's your diet like, food group? What type of exercise you're doing. Now, what I would do is I'd do assessments. I would say neck vessels healthy, inspection, oscillation, heart sounds were normal, no extra sounds. Also at this time, I would sit Ted down and I say, do you have any questions? Ted says he doesn't have any questions or issues. So this is where I would do health promotion. I would let the patient know there's possible aspirin therapy, but I might leave that to the doctor when we start dealing with drugs. But you can talk about aspirin therapy if the doctor already looked at it. Blood pressure control, cholesterol control, smoking cessation, and once again, lifestyle changes such as eating better, more exercise, or finding ways to find more stress, or going to a yoga class to relieve stress, whatever that may be, to help deal with, to increase the health of the person and their heart and neck vessel. Thank you.